Hey, great job. I'm so glad that you've opted in to not only download the two stat sheets, but to learn how to use them so you can course correct and grow your practice. I'm Dr. Russ Rosen, and I help natural healthcare providers just like you grow true optimal health and wellness practices within 6 months so you can fill your schedule to 100% capacity with your ideal patients without any sleazy sales tactics, high pressure gimmicks, or tons of marketing. In this 15-minute video, I'm going to show you exactly how to utilize these two stat sheets. If you haven't downloaded those yet, you can go ahead and pause the video and do that now. Listen, here's the deal. Most of us have a love-hate relationship with keeping stats. I know I do. Most of the doctors that I talk to hate keeping stats because they don't know which ones to keep, or they do know which ones to keep. They just don't know what to do about it once they get them. They don't know how to course correct. Or they keep the right stats, they know what to do about it, but they don't ever change because they're never making the right changes and their practices just don't grow. So eventually they quit keeping stats altogether. And gang, that's like having a rudderless ship. The truth of the matter is winners keep score. And I want you to be able to keep the right statistics, know exactly what they're telling you and what to do about them so you can course correct and you can grow your practice. Okay, so the first thing I want to do is take a look at this first stat sheet called the OHC Master Stat Sheet. What you're going to see is that there's the blue section over here, there's the brown section over here, and then down here we have statistics. And what's going to happen is that this stat sheet will figure all these statistics out for you. So let's take a look. Money received per visit, money received, percentage received, percentage overhead, case average dollars, cost per patient or cost per visit, PVA or retention, PVD, patient visits daily and reactivated patients. So you'll see that not only will you get all of these, but you'll see the description. It'll figure it out for you, and then it'll show you the formula of how we figured these out. And these are really important metrics, as you're going to see. Now, we have the blue section over here. And what you're going to see is that this is for the year. It's January, February, March, all the way down through December. So you can see that this is going to be figuring the month-end numbers. We've got the blue section, which is the classic statistics that most of us would keep. Patient visits, reactivated patients, missed appointments, new patients internal, new patients external, and the total number of new patients, and that'll figure it out for you. What was our billed services, money received? What was our total overhead? How many days were we in the office? Was it half shift? Was it one shift, half day, or was it a full day? It'll then figure out for you your retention or your patient visit average, and then it will show you the patient visits per day. Now, a lot of times what happens is you will see that 1 month, say February, will have less numbers in total patient visits right here because there's less days in the month, or you were on holiday during one of, a couple of days of the month. So I don't want to just see how many patient visits there were during the month. I also want to see how many patient visits per day. And again, we figure it out per shift. So they can really help us out. Now, obviously, those numbers can come down here and we can see, how much money we're receiving per visit, percent received, overhead, all that kind of stuff. Now, what really makes this one different is what we see in the brown section over here. We're going to be taking a look at not only the number of new patients, but how many reported findings we did. How many people of these reported findings signed up for care, pay per visit, or for a bigger plan, 1 to 2 months, or possibly a bigger plan, 6 months to a year. Now you can go ahead and double click on these and you can type in whatever you want to call those. We're going to take a look at how many people stopped before their first re-exam, how many re-exams we did, how many re-reports we did, how many people continued care after their re-report, and how many people stopped care after their first re-examination. So we have they stopped care before their first re-examination, gives us some important information we'll be talking about in a minute. or stops care after any other re-examination. Now, the second stat sheet that you're going to see in just a couple of minutes is going to be an actual dropped patient stat sheet, and we'll go into much more detail. But in this overview right here, I want to be able to see that. So let's dive deeper into this. You can see down here, we've got the year tab, then we have January all the way through December. We have instructions and we have interpretation. The interpretation is kind of what we're going through right now. So let's take a look at January. Let's say it's the beginning of the new year and you want to keep these kinds of stats because you know they're going to help you grow. So all you do at the end of the day is have your staff or yourself go ahead and put down today's date and then how many patient visits did we do today? I'm not counting names, I'm just putting a number. How many reactivated patients were there? Well, why is that such an important number? It's an important number because if you're using scare tactics and you're having your patients, when they leave, they don't want to come back to you, you're not going to have a lot of reactivated new patients. Now, to me, that means they were not under a regular care plan. They stopped regular care. They came in, they didn't just come in for a visit or two, but they started another care plan. That's what reactivated patients would mean. And again, if you go to the instructions tab, each one of these, I go into great detail about what I mean. And of course, you can just, whatever you want them to mean, they can mean that for you. So we put down the number of missed appointments, the number of new internal patients that came in today, the number of new external patients that came in today, and then that'll total out the number for you, how many new patients in total. Billed services, money received, total overhead, we put in one number at the end of the month. And then again, number of days in office, it was 0.5 is a half day or 1 is a full day. And then it will figure these numbers out for you. Now, let's take a look at the brown section. Now, here's the key. In the brown section, what we're going to do is, let's say that there were 3 new patients today, okay? And there were 5 reported findings today, all right? Again, I'm not putting down names. I'm just counting. There were 5 reported findings. 1 signed up for pay per visit, 2 signed up for a 2-month plan, and 3 signed up for a year plan, right? So really easy. Just at the end of the day, we get to figure it out. Now, is the number of new patients, if I had a new patient today, is that going to be the people we're putting down here under signing up for care? No, we're going to be looking at the people who signed up from the reported findings. What happens if they go away? They need to think about it for a couple of days and then come back. Doesn't matter. Whatever day somebody chooses to sign up for care, we just put them in here, because when we go back to the year tab, it all comes out in the wash. Okay, how many people today stopped active care before their first re-exam? How many re-exams, how many re-reports, how many continued, and how many people stopped before any other re-examination? All right, so let's take a look at the year tab and get some understanding of why these are so important for us. Let's imagine that you're really wanting to grow your internal referrals. Well, we can see if it's working or not. What if you're doing an external program and you want to see it grow? What if you want to increase your reactivations because you know you've been using scare tactics and nobody is coming back to see you, right? So obviously those give us these numbers down here, and we want to watch these grow over time. And again, on each month tab, so if we go back to January, you're going to see that this will show us all of these numbers for the month. And we go back to the year tab, they'll show us all the numbers for the entire year. So it really gives you great information. Now, this is where this really, really helps us out. I want you to imagine that you had 10 new patients, okay? During the month of January, you had 10 new patients, and you had 0 reported findings. Where's your problem? Clearly, your visit 1 sucks. You need to do something about it, right? Work with us. We'll help you out. All right, so let's assume that we have 10 new patients and we have 10 reported findings, but nobody signs up for care at all, right? 10 new patients, 10 reported findings, nobody signs up for care at all. So now what do we know? All right, well, we know, yep, people are at least starting to come back. So visit 1 is doing better, but visit 2 sucks because no one's signing up for care at all. Now, could visit 1 need some work also? Yes, but at least they're starting to come back. But if nobody's signing up for care at all, we know that visit 2 sucks. Let's imagine you had 10 new patients and you had 10 reported findings. Okay, good. So they're coming back to the reported findings. But everybody is signing up pay per visit. They're not choosing any kind of plan. What does that mean? Well, it means they're not getting the bigger picture. They don't understand the concept of getting healthy and staying healthy. They don't understand the concept of resolving their problems. Okay. What happens if we had 10 new patients, 10 reported findings, and only one of them signed up for pay per visit, but 9 of them signed up for the small care plan, right? Versus all of them signed up for the bigger care plan. You can start to see that this helps us, double click on what we're doing in visit 1 and what we're doing on visit 2 to help people really see the bigger value and the bigger for choosing a bigger care plan. All right, let's take a look at if they stopped before their first re-examination. If they stopped before their first re-examination versus they stopped before their 10th reevaluation, that gives us a lot of different information. We'll dive into that in the next stat sheet. Of course, we want to make sure that we're doing re-exams, we're doing re-reports, and that they're continuing aftercare. Now, one of the things that oftentimes you will see is the number of people that sign up for pay per visit will equal the number of people that stopped care before their first re-exam. How come? Because all they wanted was to feel better. And the reality is most people feel better within the first 12 visits. And therefore, that number might be a number you're really happy about, right? Again, it just depends on how you're practicing and what you're trying to accomplish. Again, in the interpretation section over here, we go in a whole lot more detail, but that's how you can use this stat sheet. Now, let's take a look at the second stat sheet. Now, in this stat sheet, we're actually going to be putting down the names of the people and when they quit care, meaning which was their last visit. It was a 3rd visit, it was their 10th visit, right? You can put the date right here. Personally, I don't care about it. You can put the patient number, patient name. You can see that we've got the Palmer family, and we also over here have the Disneyland family over here. And you can see the most important thing is Didi Palmer stopped on his 3rd visit. Ruth Palmer stopped on her 3rd. And the reason they stopped is because of money. Now you'll see when you click on that, there's money, time. They were satisfied with their results. They felt the doctor heard them. They were unsatisfied with their results. They lived too far away. They moved away. Staff offended patient, and all these other different reasons for people stopping, including 3 custom reasons. So when you come to the custom section over here, you can go ahead and put in your own reasons why people stop care. So you can see that these are when these different people stop care, and all I have to do is click on graphs, and you can now see that most people are stopping in the first 2 to 3 visits. That's when people are stopping. Obviously, where do I need to function? Do I need to work on my daily interactions? Do I need to work on my re-exam, re-reports? Not at all. It's visit 1 and visit 2 where I'm having a problem. They're not really getting the value of care. We might see this, and we do see it a lot, where it's 9, 10, or 11, and that's where people are stopping care right before the reevaluation. Again, there's very specific reasons why people stop right before the reevaluation. And what I want to do is I want to move them to the right. I want less and less people stopping care in visits 2, 3, 4, 9, 10, 11, and I want them stopping over here 50 and above. That's where I want to see people stopping care. Now, we also have the reasons down here. So the reason is money. Trust me on this, more often than not, it's not money, it's value. I'm not really helping them see value. And there's a lot of, in our course that we teach in communications, we go into great detail about this. It might be that they are happy with their results, meaning I just wanted to get feeling better. You never really helped me understand that I want to get healthy, stay healthy, have the best life possible, and resolve my problems. Maybe it's that you're hurting a lot of patients. Maybe it's that they're unhappy with their results. So you can see that with this stat sheet, you can go ahead and just put in when people stop active care, the specific visit that they stopped, and the reason for them stopping. Between this stat sheet and the other stat sheet, it should give you tremendous value, tremendous information as to what is going on in your practice. You can monitor the statistics that are most important to you. On that other stat sheet, we saw all those metrics that are figured out for you. Again, we show you how to figure those out, but it does it for you. And in the interpretation section, you'll get a much better understanding of what should I do about it. So what I want to do is just take a moment to show you where keeping statistics fits within our system. You'll see 3 phases: personal headspace, practice mastery, and going and growing. In phase 1, it's all between the ears, getting clear about who you are and what you do with the importance of certainty, personal growth, making sure you're ready to grow your practice, and learning how to recognize and fix contradictions. We then move into practice mastery. We make sure that we install the right operating system into your practice, just like having the right operating system into your computer. This is where statistics come into our system. We then look at our dream team, how to build and maintain a dream team, how to communicate with our patients to help them get healthy and stay healthy for a lifetime and have them happily stay, pay, and refer. We then move into the 3rd phase, which is bringing in the right kinds of new patients, flow and handling growth, and then eventually going completely weightless. So the information we just went through on keeping stats fits into that 3rd one, or the 4th one, which is the operating system. So I hope that you will download and use these stat sheets. I hope you'll go to that interpretation part and you'll really get a better understanding of what these statistics are telling you. And when they're not changing the way you want them to change, you know what to do about it. Now, once you've done that and once you've implemented that, most likely you're going to want to know more about our entire program and our systems. And we'll be sending you emails so you can set up a strategy session with me, and we can help you get clear about where you're at, where you want to get to, and how we can help you get there. As always, much love and aloha.